coming out of lockdown is great news for the UK, but for some of us, it can be just as overwhelming as going into one. And I've been talking recently with a lot of my NHS colleagues about the experiences of minority groups and the impact this pandemic has had on people's mental health. My name is Karol Kuczera. I go by pronouns he, him, and I work for NHS England and NHS Improvement in the South East. I'm joined here today by Jacob Bayliss, CEO of LGBTQ Switchboard, to talk about the experiences of LGBTQ community during this pandemic. So, Jacob, let's dive straight in. Could you introduce yourself and say a bit about the history of LGBTQ Switchboard?
Thank you. Yeah, of course. Like you said, my name's Jacob. I also use he, him pronouns. And I'm pretty new at Switchboard in some ways. So I've been chief exec for just over 6 months now. But I've been living and working in Brighton for many years since I came here as a student, which tends to be lots of people's experience. So I've known about Switchboard for a long time. So it's a real honour to now be kind of leading the organisation. But it has been a challenging time as well. So Switchboard have been around since 1975. So around much longer than me, actually. And I think we're formed at a really vital time. And at a time, I think we saw a lot of LGBT switchboards popping up around the country and, responding to a real need in local communities for LGBT people to connect and to find safe places. And really that part of what we do, that's sort of central tenet of what we do, hasn't changed. And we still do have our helpline. Back in 1975, it was in a password protected location to keep our volunteers safe. And I've had the privilege of being able to look through our archives and see some of our call records from the 70s and 80s. And of course, we took calls throughout the HIV and AIDS crisis, so lots of calls around that, lots of calls about where's the best place to go out tonight. But I think a lot of calls have remained very similar in the kinds of things we hear, kind of questions about coming out, worries about family, and people who are arriving in Brighton struggling to find the LGBT community that they've heard so much about. And I think we play a big role in trying to connect those people who are struggling to find others like them locally.
That's really lovely, actually. And there's such rich history and tapestry of your organization within our community in Brighton. I'm wondering what projects are you currently running?
So I've mentioned the helpline already, and I kind of see that a little bit as our spinal cord. So of course, we're listening every day to what our communities are struggling with and going through and perhaps wanting from services like Switchboard. And from that have grown around 10 other services. So to list a few off, we have our Grief Encounters project, which is a loss and bereavement peer support project. We have an older people's project, which works with LGBTQ people who are 50 and over. People often look shocked when I say 50, but they're technically, they're very welcome to come along. And we work with people, over the age of 100. So we have a real broad range of ages in there. We have our Rainbow Cafe, which is a dementia support project. We have a disability support project. We have a one-to-one social prescriber who works with trans and non-binary people. And that could be anything from helping them with benefits and housing to actually navigating things like healthcare. We also do training, we do research. So I think today we'll talk a little bit about some of the recent research we've been doing at Switchboard. Peer support is a big part of what we do. So for example, we also have a peer support group for trans and non-binary survivors of sexual violence and abuse. So peer support is a lot of our bread and butter, and it is again around that connecting I mentioned at the beginning. So lots of things going on at the moment at Switchboard, and I'm sure there's more to come.
Yes, absolutely. So you mentioned the research side, and I'm really interested in that because I know that you've recently surveyed the LGBT community about their experiences during COVID. So can you tell us a little bit about what you uncovered there?
Of course, yeah. So we were pleased to have around 600 responses from within the city of Brighton and Hove. So I feel like we've heard from a good number of people in the local community, and lots of different things came through. Just to touch on a few, I think housing and housing insecurity was a big issue. a lot of LGBTQ people were really struggling with the lack of safe spaces. So of course, lots of venues were closed over the last year. Lots of people were maybe forced into housing situations where they maybe didn't feel safe or weren't able to be out. And another a big sort of theme that came through, we're still analysing the results, so we haven't kind of fully broken them down yet, but having a look, has been the lack of sober spaces for LGBTQ people. So lots of people were sort of saying, lots of people spoke to us about their use of drugs and alcohol as a coping mechanism, a coping tool over the last year. And also people were talking to us about the fact that, you know, they often felt that they had no other places to socialize and to connect with communities than you know, bars and clubs and so on that kind of lend themselves to you know, alcohol and things like that. So there was definitely an ask in there around more spaces that were, you know, like cafes and daytime spaces that were LGBTQ specific. But I have to say, above and beyond everything else, mental health was the theme that came through the strongest, and unfortunately you know, the picture doesn't look good. A lot of people have been struggling. You know, some of those things were LGBTQ specific, and I'm sure some of those things are things we can all relate to as well. But by far, mental health was the biggest theme that we picked up on in our survey.
So it's so important that we get that very rich data, and we can analyze it and look at the different themes. So when will the full report be available, do you think?
We are aiming to finish the report by July. So if all things go as planned, then that should be when it's available, and we're hoping to produce some quite focused snapshots around different issues. So mental health will of course be one of those. Just to share with you a few of the initial findings that we've had. 68% of people who filled in our survey said they were feeling lonely or isolated. 74% said that they felt depressed. 33% of people who responded had thought about ending their lives. 65% felt anxious about going out or interactions outside of their home. And 40% had used drugs or alcohol to sort of support their mental health or as a coping mechanism in the past year. So I've got a long list of findings here, but those ones really jumped out to me. It has had a huge impact on people's well-being, and I'm sure that's true of many communities, not just LGBTQ communities. But I think when we look at the existing inequalities that a lot of LGBTQ communities are facing anyway, I've talked about housing insecurity, but mental health and substance abuse, those were already issues, and suicide is really a huge crisis, particularly in the trans and non-binary community at the moment. So this has really exacerbated a lot of existing issues. So we're seeing that, you know, that complexity and the severity of issues really come through even more strongly in marginalized communities, including LGBTQ groups at the moment.
So did you say there was about 33% of people who were experiencing suicidal ideation?
Yeah. So of the people who responded, yeah.
Yeah, that's a really stark number, isn't it? So, you know, thinking about the mental health of our community, what keeps you awake at night?
I think that we talk about LGBTQ community as like a homogenous group, and of course, I'm sure many of us know that that's not the case, and that people have quite unique needs and experiences. And when we break down that LGBTQ, and of course there are other letters we could add, we see some different things coming through. And I think at the moment, what's very clear is that when we look at the T, when we look at the trans and non-binary community, there are some really critical issues, and I've mentioned suicide, and this is a huge issue in this community, and I think access to healthcare goes hand in hand with that. I think a lot of healthcare providers maybe don't feel so confident when it comes to working with these communities, and it's really important that we as the LGBTQ sector work hand in hand with the NHS and healthcare providers to make sure that nobody is falling through the gaps and people are having their needs met. We asked other questions in this survey about access to healthcare and about whether people had appointments delayed, and quite a few people had seen, for example, their appointments with gender identity clinics have been delayed cancelled over the past year. And of course, when we look at the statistics around mental health, and then we look at, you know, what we see as these kind of life-saving treatments, and one is being delayed and one is getting worse, I'm starting to, you know, that's what keeps me up at night, is that this is going to continue to compound those issues and inequalities, and we are going to see a worsening outcomes for these communities.
Yeah, so I guess following on from that, do you think there may be some opportunities between the LGBTQ Switchboard and the NHS? And if so, what would they be?
Absolutely. I think something we already do quite a lot with primary care, secondary care providers across Sussex is training. We have an LGBTQ inclusion award that was co-produced with LGBT communities, and that kind of guides services along the way to perhaps being more affirming, more inclusive spaces for these communities. But I would say, you know, wherever you are in the country or in the world, if you are in need of some training around LGBTQ needs or other marginalized communities, my advice would be, do reach out to those communities specifically, rather than going to maybe a general kind of catch-all equality and diversity provider, if you can, because you're going to get a really authentic and probably a really locally relevant training from those people. But something I can share with you that I'm really excited about is that Switchboard are part of a new partnership with Stonewall, LGBT Foundation Consortium, and some other LGBTQ organisations as well. The list is quite long because there's a few of us have come together, which is what makes it so exciting, to launch a second phase of the NHS Rainbow Badges. So, you know, you might be familiar with having seen the NHS lozenge and the Rainbow Badge together. So we're looking to broaden that out, and we're doing a pilot of that very soon. And I'm very excited to say that on that pilot are some local trusts to us. So the new University Sussex Hospitals Foundation Trust, I think it is, are going to be taking part in that, as well as 9 other trusts across the country. And then it's going to be going out more widely. And that really is a structured way to look at inclusion and equality across it's a big organization, a trust. And sometimes these kind of cultural changes can be really difficult to measure, really difficult to know where to start, and when you have, when have you succeeded? How do you know? So these frameworks, I think, are really important in actually being able to celebrate success, and also, create some clear goals to work towards, and meaningful goals as well, things that really are going to make a difference. So again, I'd recommend any kind of NHS organisations who are listening to check out NHS Rainbow Badges, and you can find more about our training on our website as well.
And I guess thinking about how we can have these different conversations, and sometimes how we can even start these different conversations. What advice would you have for managers or leaders who may not necessarily identify as LGBTQ, but want to better understand the needs of LGBTQ staff?
I think the thing that jumped out at me and what you just asked is kind of that word about conversations, and something I hear a lot from people is that the worry of getting it wrong, or of causing offence, maybe saying the wrong thing, becomes quite paralyzing. And unfortunately, that means that people don't have the conversation at all. And I think that the first thing I'd love to share is just don't let perfect be the enemy of good. If you aren't sure how to approach something, I think it's the best thing you can do is be transparent about that, be honest about that, and kind of go on a learning journey. And like I said, if you do have local community organisations who can go on that journey with you and help clue you in, then absolutely get them on board. It can be tricky, particularly when you're looking at system change at large organizations. But actually, by starting with some of those smaller things, like how can we create meaningful conversations, how can we kind of remove that paralyzing fear of getting it wrong, and how can we kind of humanize this issue a little bit, I think that can go a long way to creating change. And we've seen a huge explosion in media coverage of particularly trans issues in recent years. And I think when we look at the media, when we read the newspapers and look at television, it looks like a very polarized conversation with two sides. But actually, I think that a lot of people are not in these polar camps, and there's so much common ground to cover and so many useful conversations that can be had. So I would encourage people to, have a look online, look for local groups. The one thing I would maybe say not to do is to grab the nearest LGBT person and ask them to tell you what the right thing to do is, because it happens a lot. I think many LGBT people have had that experience of being the kind of go-to person, and that's not really within their role or maybe within their expertise. So find someone who's willing to go on that journey with you, and make the most of them.
Mm. And as you say, one of the ways that you can mitigate against that and not do that is simply to get in touch with the relevant organizations. So just before we finish, how can people get in touch with your organization, and what sort of support can you offer around this?
At the moment, I'm advising people to go to our website because so many of us are working from home. So you can just go to switchboard.org.uk, and there's some contact forms on there, and there's lots more information about what we do. Or people can just drop us an email at info@switchboard.org.uk, and we'd be more than happy to help with, like I said, starting some of those conversations, doing some training, or if there's an LGBT person in your life that you're worried about, or maybe it's even yourself and you'd like to get some support, please do reach out because we're absolutely here if you need us.
Fantastic. Jacob, thank you so much for this, and all the best.
And to you, thanks for having me.
Thank you very much.